Welcome to our exploration of stress and anxiety, two emotional states that often feel similar but have important differences. Understanding these differences is the first step toward better mental health and well-being. In this video, we'll guide you through what sets stress and anxiety apart, how they overlap, and why recognizing each is crucial for your emotional resilience. Whether you're facing daily pressures or persistent worries, knowing what you're experiencing can empower you to take meaningful action. Let's begin by looking at why this distinction matters for your inner world and overall quality of life. Navigating your inner world starts with awareness. Stress and anxiety can both disrupt your daily life, but they do so in unique ways. By learning to identify the signs and triggers of each, you gain the power to respond more effectively. This journey isn't just about labeling your feelings, it's about understanding yourself on a deeper level. As we move forward, keep in mind that recognizing your emotional patterns is a vital part of self-care and personal growth. Let's dive into how stress and anxiety show up in your body and mind. Stress and anxiety often feel similar because they share many symptoms. Both can cause irritability, fatigue, and difficulty concentrating. You might notice sleep disturbances or physical signs like muscle tension, digestive issues, and restlessness. These overlapping symptoms can make it hard to tell whether you're experiencing stress, anxiety, or a mix of both. Understanding this overlap is important, as it helps you become more attuned to your body's signals and choose the right coping strategy. Next, let's explore what makes stress unique. Stress is typically a response to something happening in your environment, an external trigger that demands your attention or action. These triggers can be short-term, like work deadlines or arguments, or long-term, such as financial strain or chronic illness. The key feature of stress is that its intensity usually decreases once the trigger subsides. Recognizing the external nature of stress can help you address the root cause and find relief. Now, let's see how anxiety differs from this pattern. Like stress, anxiety doesn't always need a visible cause. It's an internal emotional state, a feeling of dread or unease about potential future harm even when no immediate threat exists. Anxiety can linger for months, affecting your mood and daily life, and is often accompanied by a sense of impending doom. This persistent worry can be hard to shake, making it different from the more situational nature of stress. Let's look closer at how anxiety manifests and why it can be so challenging. Anxiety is more than just worry. It's a persistent, excessive concern that often lingers even when there's no clear stressor. This emotional state can negatively affect your mood, daily functioning, and overall outlook. People with anxiety may find themselves catastrophizing about future possibilities that may never materialize. Recognizing these patterns is the first step toward managing anxiety and regaining a sense of control. Next, we'll compare the key differences between stress and anxiety at a glance. Recognizing the distinctions between stress and anxiety helps you choose the right coping strategies and know when to seek additional support. Stress usually has an identifiable external cause and resolves when the trigger is gone. Anxiety, on the other hand, can arise without any obvious trigger and tends to linger, focusing on feared future possibilities. Understanding these differences empowers you to respond more effectively to each and take proactive steps for your mental health. While stress and anxiety can feel similar, their causes, duration, and focus are distinct. Stress is a reaction to current demand and usually fades when the situation changes. Anxiety is a worry about what might happen in the future, often without a specific cause. This difference in focus, present versus future, can help you identify what you're experiencing and tailor your coping strategies accordingly. Let's explore what happens when stress becomes more than just stress. Chronic, unmanaged stress doesn't simply stay as stress. Over time, it can fundamentally reshape how your mind and body respond to the world. People with chronic stress are significantly more likely to develop clinical anxiety disorders. Persistent worry lasting 6 months or more is a key diagnostic signal for generalized anxiety disorder (GAD). Understanding this progression is crucial for early intervention and prevention. Next, let's look at the prevalence and impact of anxiety disorders. Anxiety disorders are among the most common mental health conditions globally. About 1 in 3 adults will experience an anxiety disorder at some point in their lives. Persistent worry lasting 6 or more months is a hallmark sign of generalized anxiety disorder. Recognizing these patterns and their prevalence can help reduce stigma and encourage more people to seek help when needed. Let's now explore the different types of anxiety disorders and their unique features. Anxiety disorders go beyond everyday worry. Generalized anxiety disorder involves excessive, hard-to-control worry across multiple topics for at least 6 months, often with physical symptoms like tension and fatigue. Panic disorder features sudden, intense attacks with symptoms such as sweating, dizziness, and shortness of breath. Phobias and social anxiety involve intense, disproportionate fear of specific objects, situations, or social interactions that disrupt daily life. Understanding these types helps in seeking the right support. Building healthy habits is a strong foundation for managing both stress and anxiety. Regular physical activity acts as a natural stress reliever and mood booster. A balanced diet and consistent sleep hygiene are essential for emotional regulation. Mindfulness and deep breathing techniques calm the nervous system and reduce reactivity. For stress, addressing the external cause by setting limits and managing time is key to lasting relief. Let's look at how to build a consistent self-care toolkit. Consistent self-care toolkit is one of the most effective ways to reduce the impact of stress and anxiety. Regular exercise reduces cortisol and releases endorphins. Good nutrition and sleep form the foundation of emotional resilience. Mindfulness and breathing techniques activate the parasympathetic nervous system, calming your stress response. For stress, planning and setting healthy boundaries are especially important. These habits support your mental health every day. Self-care is powerful, but it has its limits. If stress or anxiety is significantly impacting your daily functioning, relationships, or mood, or if self-care strategies aren't providing adequate relief, it may be time to seek professional help. Psychologists and therapists offer evidence-based treatments like cognitive behavioral therapy (CBT) and exposure therapy, which are proven to be highly effective. Reaching out is a sign of strength, not weakness. Taking control of your mental health starts with understanding the difference between stress and anxiety. Build your personal self-care toolkit. Movement, rest, mindfulness, and boundaries are your allies. Don't hesitate to seek professional support when needed. Remember, your mental well-being matters and you are not alone. With the right knowledge and support, navigating stress and anxiety becomes a journey of growth and resilience. Thank you for joining us on this path to well-being.